Good evening, everyone. I am Michelle David. I am the chair of the board of Health Equity International, St. Boniface Hospital. And with me is Father Uni, which is our host tonight as the parish priest for St. Cecilia Church, and as well as our board member. We are so grateful that you're here with us tonight. Welcome.
We just want to thank you for being so intrepid and persevering in parking here. As you know, it's always an issue here in the Back Bay, Fenway, South End sections of town, so it's a testament to all of you and our support of this beautiful organization. And we would now like to introduce the intrepid one himself, Connor Shapiro. Connor, how about a nice round of applause?
Thank you, Dr. David. Thank you, Father Uni. It's great to see so many folks who have been part of our work for so many years. There are people here who've been part of our work for over 40 years now. This work started in 1983 and it was really a group of parishioners from St. Boniface Parish, a small parish, mostly people in public housing in Quincy, Mass., who went down to Haiti over 40 years ago and started out this small clinic. That organization now has grown to be Health Equity International. Our organization has 3 pillars to our work now, and I'll explain one of the new pillars that we've done over the past year for those of you who may not be familiar with it. The first pillar and the largest pillar of our work is St. Boniface Hospital. Our hospital has grown from that one-room clinic into now a 150-bed hospital with over 500 staff members, and has become the main referral hospital for anyone who needs care, anyone regardless of ability to pay, almost all free care, for over 2 million people in the Southern Peninsula and Haiti. That hospital tonight, as we speak, has 41 babies in our NICU. There's only 30 beds at the NICU at Boston Children's, to give you an idea of the scale of this hospital at this point. We also had, this past year, about 150,000 patient visits at the hospital. That's the first pillar. And what's really remarkable about that work right now is that our hospital continues to function despite significant challenges that we've never faced in terms of security in Haiti. A lot of our staff can't travel freely back and forth to the capital. We've had to move goods by barge around in security to make sure the hospital keeps running. And most importantly, we have an unbelievably courageous and heroic staff, all Haitian professionals, medical professionals, clinical professionals, people making sure that the hospital keeps running. Those people can't be here tonight for obvious reasons because of the security situation, but they are the heroes that keep all of our work going and make sure the hospital keeps running despite all of those challenges. Despite lots of hospitals around the country who've had to shut their doors, our hospital's been able to keep going. The second pillar of our work is we also have a regional program in the south of Haiti where we work with USAID and the Ministry of Health to support a number of different hospitals throughout the region and make sure that they get support they need in terms of being able to function. And then the third pillar, which is new this year, is that we've added a new branch of our work here in Massachusetts. We actually now run 2 shelters, one in Woburn and one in Lexington for families that are experiencing homelessness. The majority of those families actually are originally from Haiti, ended up having to make very difficult trek from Chile or Brazil, mostly to the border, and then up here. And all of these families have children under the age of 18. That's how they qualify for shelter. Because of the crisis that Massachusetts was experiencing, and because of our familiarity working with the Haitian community, we decided to add this new branch of work to our work. And in fact, it helps reinforce our organization so we can do all of the programs in a really effective manner. So we have grown from those humble beginnings, that partnership of Father Jerry, who we're so excited to honor tonight, Nanette Caniff, who was also co-founder and really drove all of our growth over the years, alongside the community of Fondé Blanc Haiti, all the community members who are part of those early days and all the way through the present in terms of growing our work. That partnership has grown into the organization you see tonight. We're excited to honor Father Jerry for all that he's done to make our work possible. And he's not off the hook yet. We still have lots of work to do, and he keeps supporting us up until present day. But very excited to honor you, Father, tonight, and also show you some of our work, too, as well. So we have a video about the operations at the hospital. We wish we could bring more people to the hospital and see the work firsthand, because that's really what shows people, wow, this is what's possible in rural Haiti. This is what's possible in Haiti in terms of work and impact. But we'll do the next best thing. We'll show some videos tonight. Thanks, everybody.
We are one of the hospitals that have been working, fully working, with all the services open. People are coming to us because they don't have any other places to go. So we had this challenge also, receiving more patients than usual, more people at the emergency, more women coming to deliver. We didn't know sometimes where to go or what to do, but we also have a motivation. By getting more patients, we had more people in need of oxygen. Am I going to have enough oxygen? Am I going to lose a life because of oxygen? It is very stressful when you see that you're missing oxygen and that you need, let's say, 20 cylinders somewhere and you don't have it. So we also have employees that are underground and making calls and asking everywhere. If they tell us we have one available, we go get it because we know that we need it. But we always make sure that everything gets there. This is something that probably was meant to be for me, because this is what I like to do, to help the most vulnerable. And this is my way of doing it because I'm not a doctor. Operations is what makes the hospital run. You have to take care of everything that is related to making the hospital run properly so the medical staff can pursue their jobs. Anything that they have at the hospital, send it to operation, they'll find a solution. Everyone is motivated in what they are doing. We have many doctors, they won't give up. Whatever they have to do, they do it. The nurses, the same thing. And for my team, it's the same thing. I always want to see everyone working and doing their best. It's the motivation and the team that we have behind us that makes it happen.
Good evening, all. My name is Wilfried Cadet, and I've been involved in this organization since 1994 as a young medical graduate. So the dedication that you see has been inspired by the commitment of our founders, Nanette Canif and Father Jerry. They embraced the cause of that Haitian community and carried it forward. Last night, I was giving a presentation to some Tufts students, and we were talking about change in the world. I asked them to be bold, to be patient, and to be human. When I was using those three adjectives, I couldn't stop thinking of Father Jerry and Nanette, because to start something like this in a country which you never visited, and to commit most of your life to grow it the way it has grown, you must be bold, you must be patient, and humanity must conspire in everything that you do, in everything that you start. So tonight, I am proud to be a friend of Father Jerry, but he has also been an inspiration to me. And because of all this, I am proud to present you with this gift, the original Work for Hunger shirt that you wore when you raised the first money for Haiti.
Thank you very much. I guess we smile for the camera.
Yes, yes, good. Let's...
Am I supposed to talk now? Well, it's wonderful to see all of you here. Thank you so much for coming, not so much for me, but for the hospital and now the shelters also that we have a responsibility for. I think I'm supposed to have something to say after another video, so I will just thank you for the shirt that won't fit me, I'm sure.
Father Jerry Osterman is our unsung hero. Tonight is our opportunity to honor our hero for his life's work, which has been guided by the belief that all people matter.
You see something and think about it, and it jars you in some way, and maybe say, well, is there anything you can do? The answer, if you will, is health and education.
With a heart as big as his vision, Father Jerry walks shoulder to shoulder with people, helping them to meet their needs and reach their dreams. In this same spirit, Father Jerry and a group of his parishioners from St. Boniface Parish in Quincy, Massachusetts, began working with the people of Fond-et-Blanc, Haiti. This early partnership was just the beginning of an extraordinary journey.
He always wanted to work with the poor. He gathered this group of people at St. Boniface and talked about that, and the next thing you know, we were on a flight to Haiti. Father Jerry said, we just can't not go again. You just can't not do something more.
We kept coming back, and people began to trust us. The people soon become people, persons, and not statistics.
He had the vision, always, of, I think, where it was all going to go from nothing to this wonderful place we have there now, this wonderful hospital.
Father Jerry's optimistic spirit, ever present, was a guiding force behind St. Boniface Hospital's growth and expansion over the next 4 decades.
He's just been so open, and yet has always grounded us and rooted us what the original mission is, reminding us of these things. He has something that roots and tethers us in what they started, and also what allows things to become what they are today.
This is a big advocate for social justice, someone who keeps his doors open to everyone. I mean, in a world where there are some tensions, Father Jerry is very welcoming to everyone.
Francis of Assisi had once said, preach the gospel always, and if necessary, use words. To me, that's what the gospel is all about. You just see a situation, you think, well, how can it be better?
His vision championed the start of our HIV program. His vision led to the creation of a remote clinic. And it's this vision that has encouraged hundreds of people to come together over the course of 40 years in support of this important work.
What St. Boniface has had is the longevity, which allows us to begin to see some results, that things can and do change.
Father Jerry's compassion and commitment to helping the underserved knows no borders. Even here in Massachusetts, he has helped create schools, programs for migrants, and interfaith organizations. Father Jerry has never stopped working to make the world a safer and more inclusive place.
He has used his priesthood to the very best of his ability and the best of what a priest can be.
There is the priest, there is the educator, there is the advocate for social justice, there is someone who really embraces education, who wants to see the next generation doing better, the next bright person to really make a big change in the world.
He brings this presence of authenticity. He's humble, he gets it done. He has a phenomenal sense of humor, laugh, which lightens even the heaviest of things. And stuff just goes and grows. And look at HEI today.
Father Jerry, we will never know just how many millions of lives you have touched. For those of us who have been fortunate enough to walk beside you, we offer our most heartfelt thanks for all of the extraordinary good you have done.
Thank you, Jerry, for always sharing your generous, warm, and loving heart with all of us and with the most vulnerable. You inspire us each and every day. Love you, Jerry.
I will assure you that we will continue your legacy, working to get a better hospital for the community and for the whole South Department.
Jesus had an eye for the neglected and the poor, and I think you have that wonderful characteristic as well. Thank you for showing this poor Jesuit what apostolic zeal really means. Congratulations.
Your dedication, your friendship, and your mentorship means so much, not only to me, but to all of us at the St. Roch Haiti Foundation. Congratulations, and thank you for always encouraging us and inspiring us, and for all of your goodness.
Nous aider moun, faire l'hôpital la marcher bien.
You have touched so many people's lives doing God's work throughout your life. But nowhere was there a greater impact made than what you created in Haiti.
Nous ne pouvons jamais oublier toute ça qu'il fait pour nous. Toute salve, toute balle, il fait pour nous très très bien. Après merci pour tout bien le fait pour nous dans Saint Boniface, nous dans la communauté.
I just wanted you to know it's been a great privilege to have worked with you at Mother Caroline and St. Boniface in different capacities for 29 years. Thank you for your dedication to these organizations.
Nous disons merci avec Père Jerry pour tout ça qu'il fait pour nous dans la communauté, Fond des Blancs. Bon, nous pas qu'à fin dire merci, c'est bon Dieu seul qui a.
Whenever Father Jerry would say, I have an idea, I'd say, uh-oh, this is going to cost money. This will take up time. But as usual, he was always right and cared about doing something for the poorest of the poor. Thanks, Jerry.
Thank you for a lifetime of service and for all you still continue to do in Haiti and the greater Boston area. Your impact knows no border and no bound.
C'est le bon Dieu qui est capable de récompenser Père Jerry tout ça qu'il fait pour nous dans Fond des Blancs, spécialement dans la communauté, tout le monde, tout le monde.
St. Boniface Hospital is the heart of the Fond des Blancs community, providing jobs, healthcare, and education.
But your impact and the impact of St. Boniface Hospital is far-reaching.
Thank you, Father Jerry, for all that you've done at Health Equity International. Thank you for starting this work so many years ago, and thank you for continuing to be a model for us as we continue to build on that mission.
Father Jerry, I want to say thank you for so much dedication, generosity, and love to the people in the South Haiti and Fond des Blancs.
Well, before I begin, I want to single out one beautiful woman among so many beautiful women here tonight, I'd like to say thank you to Nanette Caniff. Nanette has always kept us keeping on, especially when the road got a little rough. And so, Nanette, thank you from the bottom of my heart. Murphy called the Aer Lingus office in Dublin, and he said, I want to know how long it will take to fly from Dublin to Boston in one of those big 747s. And the voice on the other end of the phone said, just a minute. He said, Glory, isn't that marvelous? Well, you know, 41 years have seemed like just a minute. Time has gone by so very fast, it seems, especially when you look back and see all that has happened. Someone has said that old age is like a natural monastery. And I think there's a lot of truth in that. In this monastery, you know, the circumference of your work begins to shrink, your activity begins to wane. You tend to be sedentary. And yet, it's a time for thinking and remembering and thinking about what's ahead. In terms of remembering, I had a dream. And I had this dream about 10 years after we started going to Haiti, just after we built the first part of the hospital. Prior to that, as Connor mentioned, we were in a one-room clinic to which we added another room and then another room, and then finally made the decision with Father Guelo to build a hospital. And when I saw it finished, one night my dream was that maybe someday this will be Mass General South. I shared it with no one but my psychiatrist, and he said I was hallucinating and gave me a prescription. But I never took those pills, and I never lost that dream, which, as time has gone on, the hospital seems to be getting more and more complex. But one thing we have over Mass General is you don't have to sleep in the corridor for 48 hours before you get a room. So I think that this dream is really shared by all of you. Perhaps you haven't thought about it, but if you didn't have some sense of a dream for equitable health care for others besides ourselves, you would not be supporting us. Your support of us and for what we do there is the manifestation of your participation in the dream. So maybe we should see this celebration as the halfway mark. 41 years, we have come this far. You can go another 41 years. You notice I've changed the pronouns. I will be in the monastery garden. But you can bring the dream even to a greater reality, and maybe it really will be Mass General South. Thank you all so very, very much.
In the previous video, you heard many people speaking about Father Jerry's generosity, humanity, hospitality. And that hospitality, having his doors open to everyone, to the strangers, somehow he embodies Matthew 25 when Jesus said, I was homeless and you provided me with shelter. So that reality has kicked in Massachusetts. And Connor mentioned earlier that right now we are running 2 shelters in Massachusetts. I was privileged to serve as an interim director in this project. It was a learning experience, a humbling experience for me, but also a joyful experience. Not only to be able to really serve the Haitian community here, but also to transition this work and the challenges that it has to the new project director. Please, I would like to have your attention to really watch this video about our shelter and stabilization services project.
Massachusetts, being the only state to have a right to shelter for families, has made it really fascinating for us, because in my 40 years of working everywhere around, I've never seen a family on the streets of Boston. We're in that kind of struggle now of how do we honor a real deep and long-standing commitment to make sure families have a right to shelter.
When this crisis first started here in Massachusetts, we started receiving lots of calls at Health Equity International because we've been working in Haiti for over 40 years, and because the population of unhoused migrant families that was coming here to Massachusetts was mostly from Haiti.
There was a big challenge to figure out how do you create this quickly and who would be able to manage something like this and handle this. And that's where Health Equity International was like an invaluable resource for our state government, for all of us who are in charge with taking care of these families.
We felt like we needed to respond in a meaningful way because we had that experience and that expertise that could help these families.
The Shelter and Stabilization Program is about receiving families. Our job is to give them a place to stay, some food, shelter, and to be able to provide them with the care that they deserve. Even when they leave our care, they still get our support so that they actually assimilate and stabilize in this country. We need to make sure that they have the work development that they need so that they can acquire great jobs. We are providing support on all fronts and every step of the way.
We provide a lot of case management, so it's meeting one-on-one with families, helping them, helping their kids make sure they're enrolled in school. We work closely with Lexington Public Schools. Our staff, our team is in close contact with social workers and different parties there to really understand some of the gaps and how we as an agency can fill them.
One of our core values, which is one of the things I like about Lexington, is we all belong.
With HEI, they have been fantastic. They've been great at just being supportive and helping us understand how we can help the families and the students.
It's just beautiful to watch how these kids get to go to school and get to live out their dreams.
We can't be our best selves if we're struggling to survive, and I want to see my clients, my people, strive to be the best of themselves.
This is all about welcoming people, caring for them, and understanding the journey they've had and the trauma they've been through.
They deserve a chance at a better life. That's what they came here for. I mean, that's what any parent wants, right?
No matter where we are, Massachusetts, in Haiti, wherever it is, everyone has the right to a life of dignity and hope and respect.
Thank you so much for being here, for honoring Father Jerry. And it's truly inspiring to see so many of you gathered in support of our important work. This past year has been incredibly challenging for our dedicated staff and for the resilient people we serve. In Haiti, 6 years of relentless crises have culminated in one of the most severe humanitarian crises the country has faced in generations. And around the world, we see people fleeing their home, forced to leave behind everything in search of peace, safety, and a brighter future for their family. It has been a difficult year because many has lost hope on Haiti, on migrants, simply seeking a better life. You know, we have a name for it even. It's called Haiti fatigue. But standing here with all of you, I'm reminded why we never give up. Because the lives of those we serve matter. Pastor Jerry, you know that. Because together, we are making a real difference. We will not give up on this work or on the people who count on us. And I know that by being here tonight, you won't give up on them either. Despite every obstacle, our team shows up every day to deliver exceptional care. And you have to know in Haiti the sacrifice they make. Most of the best school systems are in Port-au-Prince, and they live in southern Haiti. So some of their family are in Port-au-Prince, and they can't, because of the security, travel back and forth to Port-au-Prince. So their family in Port-au-Prince, and they are practicing and taking care of people in Haiti. So their dedication matters. For example, as Connor says, we've taken care of a lot of people. We welcome over 4,000 babies, more than most hospitals in Boston, and we support them with a NICU. Can you imagine that? First world care in a low-resource country? Our surgical team performed over 8,000 procedures, including 400 life-saving orthopedic surgeries, the only hospital in southern Haiti offering this service. Nearly 10,000 people visited our emergency room, which is a 24/7 open. Do you know how rare that is in Haiti? So we are available to people in moment of crisis, and not a single patient was turned away due to inability to pay. Our new shelter project in less than 6 months has already impacted thousands of unhoused families who have endured unimaginable hardship. Their children in our care are attending school, gaining the education they deserve. Adults are finding stable jobs, families are moving in safe and permanent homes, and we are providing many other services to help them rebuild and work toward independent futures. These are people who have nowhere else to turn, and we are honored to stand by them during their most difficult time, helping them see that better days are possible.
Thanks, everybody. Be real quick. Just a huge thank you to everybody for your support tonight. It makes an enormous difference for our work in Haiti. It makes an enormous difference for our work here. I just want to say a quick thank you to our dinner committee led by Beth Floor, Kate Ascione, Sharon McNally, Michelle Brennan, and then everyone else on the team. I'd like to thank Father John and Lisa and everybody here at St. Cecilia for hosting us. I'd like to thank Lisa Epic from our team for leading the charge on our team in terms of putting all this together, as well as everyone from our team. Thank you, Lisa. Just thanks to all of you. We are really excited to be partners with you in this work. We're going to let you get back to socializing. Please feel free to reach out to anybody here tonight if you have any questions from our team. And have a great night, everyone. Thanks all. Thanks, everyone.